My name is Holley Trimble. I am a student at the Mississippi University for Women, the RN to BSN program, and today I'll be talking to you about the national opioid crisis. The objectives are to educate regarding the national opioid crisis, be able to identify signs and symptoms of opioid addiction and overdose, identify proper resources to treat chronic pain illnesses, and identify ways to reduce the contributions to the opioid crisis. What is an opioid? Opioids are a class of drug naturally found in the opium poppy plant. Opioids are substances that act on opioid receptors to produce morphine-like effects. Medically, they are primarily used for pain relief, including anesthesia. Some examples of opioids are morphine, hydrocodone, oxycodone, and methadone. What is the national opioid crisis? The opioid crisis is the rapid increase in the use of prescription and non-prescription opioid drugs in the United States. Here's some statistics of the opioid crisis. Every day there's thousands of overdoses regarding opioids. 78 people die every day from opioid overdose in the U.S. 60% of those drug overdoses involve opioids, and 50% of all opioids deaths involve a prescription. Impact on healthcare, increase in 911 calls regarding drug overdose, which leads to a delayed care for other patients. Also an increase in the number of ER visits due to drug seekers. Bullying from the addict to be prescribed more opioids. Signs and symptoms of opioid abuse are euphoria, cravings, sweating, chronic constipation, reduced sex drive, sensitivity to pain, shallow breathing, slurred speech, small pupils, and nausea. And also family members, you'll start to see them struggle financially. Community involvement. Many communities are starting to find ways to decrease the abuse of opioids. One way that my community and where I work has tried to decrease that is that we have a pain clinic, and with our pain clinic, the doctors, you'll come in and you'll get diagnosed with your chronic illness, and they'll determine what medications are best in treating your pain, what combinations, and also if you are a member of the pain clinic, if you come in and you have surgery, their doctors have to work with our doctors, and they have to approve the medications that are going to be prescribed to them, and if at some point in time, if it's suspected or if they're caught getting pain medication elsewhere, then they will actually be cut from the program, and that really helps with compliance with their pain medications. Another thing is a local emergency department. They have a guideline, and some of their guidelines are the patient will be treated with narcotics on no more than 3 visits in a 12-month period. They will not replace any narcotic prescriptions that is lost, stolen, expired, or destroyed. Demerol will not be prescribed or given in the emergency department. And then the following patients will not receive any narcotics at any time. Patients who have been receiving narcotics from multiple providers, patients who have forged or altered prescriptions, patients who give false information or attempt to obtain medication with false information, and if 2 or 3 occur, law enforcement can be notified. Prevention, what can we do? As healthcare workers, healthcare providers, we just need to be cautious with prescribing pain medication. When they are necessary, only the smallest dose that can relieve their pain needs to be prescribed. We need to educate about the use of opioids. Patients, they need to follow the directions as explained by the label or the pharmacist. They do not need to change a dose regimen without discussing it with the doctor. and they need to be aware of potential interactions with other drugs as well as alcohol. And then here are just a few references that I got my information from.